Welcome to the deep dive. Today we're tackling a really serious medical challenge, intracranial abscesses.
Right. These are essentially dangerous pockets of infection within the brain or, the spaces surrounding it.
Exactly. And we've got a great resource to work with, Chapter 19 from the textbook Hyperbaric Medicine Practice.
Ah, yes, the one focusing on adjunctive hyperbaric oxygen therapy, HBO2.
That's the one. So our mission today is really to explore how adding HBO2 to the standard treatment plan might offer a real advantage based on what the medical literature tells us.
And it's crucial because these abscesses, they're no small thing.
Ah.
Even with all our medical advances, the textbook points out that mortality rates are still, well, unacceptably high.
Historically, what are we talking about? Like percentage-wise?
Historically, the average was around 19%, maybe 19.2% over, say, 35 years.
Wow.
Yeah. Now, it has come down, thankfully. Recent studies often show it below 10%.
Which is better, but still.
Still a major concern, absolutely. And the source really emphasizes that. Plus, for survivors, long-term issues like epilepsy are sadly pretty common.
It's kind of sobering when you hear how relatively rare they are, isn't it?
It is. The frequency is roughly similar to, maybe slightly higher than, things like gas gangrene or necrotizing soft tissue infections.
So maybe 3 to 5 cases a year in a big hospital.
Something like that, yeah. Which really highlights how specialized the treatment approach needs to be.
Okay, so the core idea then, using pure oxygen under pressure for an infection inside the head, it sounds intense. What's the thinking there?
Well, it's an interesting question, and the rationale actually connects directly to how HBO2 is already used quite successfully for other serious infections.
Like the gas gangrene you mentioned.
Exactly. Gas gangrene, necrotizing soft tissue infections, those are the key ones. The UHMS, that's the Undersea and Hyperbaric Medical Society, and the European Committee, ECHM, they both approved adjunctive HBO2 for those conditions.
When was that?
EHMS was back in '94, and ECHM in 2004. So the principle isn't entirely new, even if applying it to the brain feels like a bigger step. It's grounded in established practice.
So it's not just a wild guess, but our sources do mention that specific animal data for brain abscesses is a bit scarce.
That's true. Extensive animal studies are somewhat limited, but what we have seen is this growing number of case series and, anecdotal reports from treating actual patients.
Real-world data.
Exactly.
Yeah.
By 2016, they'd actually gathered data from 7 different hyperbaric centers internationally,
Okay.
and that covered 230 patients in total. So while it's not randomized controlled trials, it gives us something substantial to look at, which we definitely should.
Right. So a key part of understanding this has to be knowing what kind of bugs we're dealing with in these abscesses.
Absolutely critical. And this is where HBO2 becomes particularly relevant. The sources really stress how common anaerobic bacteria are.
Anaerobic meaning they don't like oxygen.
Precisely. Some studies find them in up to 90% of cases.
90%. That's huge.
It is. But you have to understand, that number really depends on how good the lab is at culturing them. You need specific techniques.
So older studies might have reported sterile cultures just because they couldn't grow the anaerobes?
That's very likely, yes. They might have missed them if the anaerobic culturing wasn't up to scratch.
Makes sense. An abscess seems like a perfect spot for oxygen-hating bacteria to thrive. Does the chapter list specific ones?
It does. Based on their own series of 25 patients, they found things like Peptoscriptococci, Bacteroid species, Fusobacteria,
Nasty stuff.
even Clostridium perfringens, Veillonella, anaerobic strep, Actinomyces, Prevotella oralis. It's quite a mix.
A real rogues gallery. Any others?
Yeah. They also sometimes found microophilic strep. Those are kind of intermediate oxygen users, and some aerobic staph species, too.
Okay.
But here's something really interesting they found. In patients where the abscess seemed to come from a sinus infection, they call those rhinogenic.
Right, from the nose or sinuses.
Yes. They often found predominantly anaerobic bacteria in the brain abscess, even if the cultures from the sinuses only showed aerobic bacteria.
Huh. That's weird. So the environment in the brain selects for the anaerobes.
It seems that way. It suggests a very specific process is happening. The source mentions Lamble and colleagues have more case reports on that specific point.
Fascinating. And does the source differentiate between bacteria in, say, abscesses from trauma versus those starting internally?
Not really. It notes a lack of data comparing the bacteriology based on origin, whether it's endogenous or exogenous, like from trauma.
Okay. But the bottom line is we know HBO2 works well against anaerobes and other bugs.
That's well documented, yes.
Yeah.
So if these oxygen-avoiding bacteria are often the main problem, how does flooding the body with oxygen under pressure actually fight them?
Good question. What are the mechanisms?
There are several key ways it's thought to help. First, let's talk about the swelling or the abscess, the
Yeah.
peripheral edema, and the dangerous rise in intracranial pressure, ICP.
Right. The swelling itself can cause huge problems, squeezing the brain.
Exactly. As the abscess grows and the swelling increases, it can cause secondary damage and life-threatening pressure spikes.
So how does HBO2 help with that?
It works through the blood vessels. The really high oxygen levels in the arterial blood cause the small, autoregulated blood vessels in the brain to constrict.
Vasoconstriction.
Correct. This narrowing reduces the overall blood flow into the brain slightly and cuts down the total volume of blood inside the skull. Less volume means less pressure.
Okay, that makes sense. Less pressure, less squeezing.
Precisely. And importantly, while it's doing that, HBO2 also makes sure that even brain areas that might be low on oxygen because of the swelling or infection still get enough O2 delivered.
So it's helping reduce the dangerous pressure and supporting the surrounding brain tissue.
Yes, and the authors make a really key distinction here, because HBO2 is actually targeting the anaerobic bacteria that are often driving the infection and the swelling.
It's not just treating the symptom, the high pressure.
Exactly. Its effect on the edema and ICP is potentially curative, addressing the root cause, unlike just giving drugs to temporarily lower pressure. They even mention an anecdotal case where HBO2 helped with critically high ICP.
That's a powerful combination. What else does HBO2 do?
Another major benefit, and one that's well established, is how it enhances the body's own immune system.
How so?
Specifically, it significantly boosts the function of leukocytes, the white blood cells, makes them more effective infection fighters.
So it helps our own body fight back better at the site of the abscess.
Right, and this is particularly useful, as the source points out, if there's also an infection of the skull bone, osteomyelitis, which can happen with these abscesses.
Ah, right. You mentioned abscesses can sometimes start from sinus or ear infections, which are close to the bone.
Exactly. So if you have that concomitant osteomyelitis, HBO2 is a really powerful addition to the surgery and antibiotics needed for that bone infection too.
So it tackles the infection on multiple fronts. Does it do anything else?
Well, there are other potential effects. Our sources mention a 2012 study in rats.
Okay.
It looked at the early healing stages of brain abscesses. The findings suggested HBO2, either alone or with antibiotics, seemed beneficial.
Wow.
It appeared to promote the growth of new blood vessels, increase vascular density in the area, and, interestingly, reduce the amount of dead necrotic tissue in the abscess.
So better blood supply and less dead tissue? Sounds like faster, better healing.
That's the implication, yes. And there's another potential mechanism. Some evidence suggests HBO2 might temporarily open up the blood-brain barrier.
The barrier that normally protects the brain but can also keep drugs out.
Exactly. If the inflammation around the brain isn't too severe, sometimes antibiotics struggle to get into the brain tissue at high enough concentrations.
So HBO2 might help the antibiotics get to where they need to go.
Potentially, yes, by making that barrier a bit more permeable, reversibly. Plus, the extra oxygen in the tissues from HBO2 can directly boost the killing power of certain antibiotics, like aminoglycosides.
Wow. Okay, so it's really hitting the problem from multiple angles. Kills anaerobes, reduces pressure, boosts immunity, maybe helps healing, and improves antibiotic delivery and effectiveness.
It's quite a list of potential benefits, yeah?
That's a really compelling picture. The source material even includes a specific case report that kind of brings all this together, doesn't it?
It does, yeah. A really striking case. It was a young boy, only 4 years old.
4? Oh, wow.
Yeah, and he developed multiple brain abscesses, secondary to a lung abscess, tragically.
Goodness. And what were the bugs?
Anaerobic and microaerophilic streptococci. So right in that category we discussed.
And the treatment?
He had limited neurosurgical drainage, some repeated aspirations to draw out pus, full-on intensive care, and crucially, they started HBO2 immediately.
Immediately.
Though it was limited. Only 6 sessions initially, because he then needed surgery for the lung issue.
And the outcome for him, despite how serious that sounds.
Remarkably positive. He actually made a full neurological recovery. No lasting deficits. Started school at age 6, completely normal.
That's incredible. From multiple brain abscesses at age 4.
It really is. It's a powerful example of what might be possible with this adjunctive approach.
So, building on that single case, the chapter then looks at broader experiences, these international case series using HBO2. What did they find collectively?
Right. So the authors first share their own institution's data. Between 1983 and 2016, they treated 25 consecutive patients who had intracranial abscesses with adjunctive HBO2.
Did they have specific reasons for choosing HBO2 in those cases?
Yes, they had clear criteria, things like confirmed anaerobic or mixed infections, patients with multiple abscesses, or if the abscess was in a really difficult spot deep or in a dominant brain area. Also, cases where the infection was life-threatening.
Makes sense. And what was their typical HBO2 protocol?
Usually sessions at 2.5 ATA atmospheres absolute, so 2.5 times normal air pressure
Okay.
for 60 to 90 minutes. Usually once or twice a day, depending on how sick the patient was.
And the results in their own series of 25 patients.
Quite remarkable, really. They reported 0% mortality, 0.0%.
Zero. That's amazing for such a serious condition.
It is. And beyond survival, 72% had a complete neurological recovery, and 76% got back to their former work or life activities.
Wow. Was this just their center, or did others see similar results?
No, it wasn't just them. They found similar findings from other groups internationally: France, Austria, Germany, the U.S., Turkey.
So multiple places seeing this pattern.
Yes, all reporting very low, or even zero, mortality rates in their patients treated with HBO2, often in very severe cases too.
Any particularly notable studies?
Well, they highlight a study from Mathieson and Lind in Sweden. They also had 0% mortality in their group of 56 patients.
56 patients, 0 deaths.
Correct. And they also showed a marked reduction in permanent disability.
So if you pull all that data together from these different series.
Right. So pulling together the data from 7 series up to summer 2016, which included those 230 patients getting adjunctive HBO2, the overall mortality rate was just 4.3%.
4.3%. And how does that stack up against standard treatment during the same time frame?
That's the crucial comparison. The authors looked at 29 other studies from the same period, covering almost 1,500 patients, 1477, treated conventionally without HBO2.
Okay. And the mortality there?
The average mortality in those conventional treatment groups was 19.2%.
19.2 versus 4.3. That's a huge difference.
It is, and statistically, it was highly significant. The analysis showed adjunctive HBO2 was linked to a significantly better survival rate. It suggests a real substantial benefit.
That's incredibly compelling data, even if it's not from randomized trials. So, given all this, what's the current thinking? When should doctors consider using adjunctive HBO2?
Yeah, the authors are quite clear on this. First, HBO2 is adjunctive. It's not a replacement for the standard stuff.
Right, you still need the neurosurgery, the right antibiotics.
Absolutely. Neurosurgical management drainage or aspiration-appropriate antibiotics, and sometimes steroids, although steroids are a bit controversial.
Why controversial?
Well, they reduce swelling, which is good, but they can also suppress the immune system, which is bad for fighting infection. HBO2 might actually help counteract that downside of steroids by boosting immunity.
Interesting point. So it's always part of a combined approach. What specific situations trigger considering HBO2?
The chapter lays out several key indications. Cases with anaerobic or mixed bacteria, like we discussed.
Okay.
Patients with multiple abscesses. If the abscess is deep or in a critical brain area, like the dominant hemisphere.
Makes sense.
Also, patients who are immunocompromised, their own defenses are weak. Situations where surgery isn't possible or is just too risky.
Right.
And maybe most critically, if the patient isn't getting better with the standard treatment, say, after a couple of aspiration attempts and antibiotics, or if they're actually getting worse.
And the timing matters.
Very much so.
Yeah.
They really stress starting HBO2 early if you're going to use it. Don't wait until it's a last resort.
Why?
To maximize the benefit and, hopefully, prevent irreversible brain damage.
Yeah.
The earlier the intervention, potentially the better the outcome.
And the recommended treatment settings?
Generally 2.5 ATA, once or twice daily, based on how the patient's doing. And the number of treatments isn't fixed. It's tailored to the individual.
How do you decide when to stop?
Based on clinical improvement and follow-up scans like MRI showing the abscess shrinking or resolving.
They seem to argue quite strongly for using it despite the lack of huge randomized trials.
They do. Their argument is essentially that the condition is so serious, the mortality and long-term disability risks are so high that the compelling evidence we do have from these case series justifies its use.
Plus the risk-benefit balance.
Exactly. They point out HBO2 itself has a relatively low complication rate and cost compared to the massive overall cost and complexity of treating these critically ill patients. So the potential benefit seems to outweigh the risks significantly.
And they think the full benefit might be even clearer if we tracked outcomes better.
Yes. Looking beyond just survival tracking, things like seizures after infection, lasting disabilities, ability to return to work, they believe tracking those factors more carefully would really highlight the value HBO2 adds.
To really drive the point home, they include one more recent case from their own experience, right?
Yes, a more recent example. This was a 32-year-old man. He came in with headaches, found to have pansinusitis infection in all his sinuses, and an epidural empyema, basically a pus collection, over his frontal lobe.
Okay. Initial treatment.
Standard stuff.
Yeah.
Antibiotics, surgical drainage of the empyema.
But
Follow-up imaging showed a new septic focus had developed deep inside the brain, in the capsula interna, a really critical spot.
oh dear. And what was the bug from the first infection?
It was actinomyces and anaerobe.
So despite adjusting antibiotics, this new deep abscess wasn't clearing up.
Correct. It wasn't responding. So considering the deep location, the known anaerobic pathogen, and the lack of response.
They decided on HBO2.
Exactly. They initiated adjunctive HBO2. He had 11 sessions, 2.5 bar, 90 minutes each, once a day.
And the outcome for him?
Fantastic, actually.
Yeah.
Follow-up MRI about a month later showed the abscess was completely gone.
Wow.
He made a full neurological recovery, went back to work. Another really positive outcome in a tough situation.
Okay, so let's wrap this up. As we finish our deep dive, can you just quickly recap the main potential advantages of adding HBO2 for intracranial abscesses based on this chapter?
Sure. So we've seen it offer several potential benefits. It directly targets those anaerobic bacteria that are often involved.
Right.
It helps reduce dangerous brain swelling, the edema, and the resulting high intracranial pressure.
Key point.
It boosts the body's own immune defenses, helping fight the infection. And it might even help antibiotics get into the brain better and promote tissue healing.
And maybe the most compelling piece is that statistically significant difference in survival rates seen in the case series data.
Absolutely. Comparing patients getting standard care alone versus those getting standard care plus HBO2, the data reviewed here shows a major survival advantage for the HBO2 group.
It really is striking. Now, we acknowledge it's mainly case series data, not those big gold standard randomized trials.
True, that's a limitation. But given how rare and how severe this condition is, the consistency of these findings across different centers is really hard to ignore. It presents a very compelling argument.
It certainly does. So as we leave you, our listener, with this information, here's a final thought to consider. Based on the evidence we've discussed today, how do you see the role of hyperbaric oxygen therapy evolving in the treatment protocols for these serious brain infections going forward? And maybe what kind of research would you think is most needed now to really pin down its best use and maximize its potential to help patients facing this incredibly challenging condition?